Hi, good afternoon. Is that Rebecca Smith?
Oh, hello there. Yes, thanks for phoning back.
My name is Dr. Vijay. I'm calling you from the clinic. Before we start, can I just check your date of birth?
Yeah, of course. It's the 10th of October 1984.
And your address, please?
It's 123 West Street.
Okay, and I've got a message on my screen is that you've got a cough. Is that right?
Yeah, I've had this really bad cough for the last couple of days, yeah.
Okay. Is it just a cough which is there occasionally, or is it you're coughing most of the time?
It started off occasional, but now I'm coughing quite a lot more.
Okay, and do you know if you felt hot or had a fever at all?
I have had a bit of a temperature, yeah. I've had some paracetamol and it seems to have come down a bit now, but I have had a fever, yeah.
Okay, do you have a thermometer at home at all?
I have, yeah.
Okay, and has your temperature been above 37.8?
It was 37.9 yesterday evening, but this morning it's 37.6.
Okay, and have you had a dry cough? Have you had a sore throat?
No, it's been a bit scratchy, but it's been okay.
Okay, and how's your sense of taste and sense of smell? Have they been?
So actually 3 days ago, it's funny that you mentioned that. 3 days ago, I couldn't smell anything.
Okay.
Taste-wise, I just don't feel very hungry, to be honest. I feel just generally a bit rotten.
Okay.
Yeah.
And have you had any chest pain at all?
No, my chest isn't hurt at all.
Okay. And have you had any dizziness at all or feeling faint?
No, I haven't been dizzy at all. I just ache all over. It feels like a really bad cold.
Okay. When did you last pass any urine?
It was just this morning when I woke up, maybe about 3 hours ago.
Okay, and eating and drinking, how's that been?
Oh, I'm just not hungry, to be honest. Like, I'm forcing myself to. I had some porridge this morning, and like I'm drinking as much as I can.
Okay. Now, I just wanted to ask you about your breathing. Do you feel you can talk in sentences without feeling breathless?
Yeah, I think when I'm speaking, I don't notice a problem.
Okay. And how are your activities at rest? Do you feel more breathless when you're resting or just watching TV?
No, I don't think so. When I'm sitting down, I'm fine.
Okay. And in terms of activities around the house, like vacuuming and stuff like that, how's that been with your breathing?
I can do everything, to be honest. I think when I ran up the stairs the other day, my breathing felt a little bit more difficult, but otherwise I'm just doing everything I normally do. Okay.
And compared to yesterday, in terms of your breathing, in terms of your talking in sentences, breathing at rest or activities, do you feel much worse since yesterday or about the same?
No, I think my symptoms are just as the same as what they were yesterday, to be honest. I think I phoned because I'm a bit worried about this coronavirus thing, and I thought it's probably best to let you know that I've had this cough.
Okay, now because you're fairly new to the practice, I just want to check. I don't have all your medical records yet. Do you have any other medical problems at all?
No, I don't have any medical problems. No.
So anything like diabetes, asthma? Any problems with epilepsy?
No, I've never had any problems like that, thankfully.
Okay, any conditions which affect your immune system at all that give you low immunity?
No, not that I know of.
And I'm just checking, are you on any regular medication?
I just take some paracetamol like I have been doing the last few days.
Okay,
That's it.
Or any drug allergies?
Not that I know of, no.
Okay. Well, I think in the current guidance and climate which is out there, you actually do fit the criteria for a COVID infection.
Oh, I knew this was going to be the case. Oh, I'm pleased that I rang. Okay. What do I need to do?
Well, the good news is we do a remote assessment over the phone. You're passing most of our criteria for a mild infection. You don't have any chest pain. You don't have any your breathing intensity, your talking intensity is okay. You're able to do your activities around the house. Where, touch wood, I don't think we need to do anything specific. And most people, especially a young fit person without any medical problems, will generally just get better. Most of the cough most of the cough should settle by about a week, but a bit of a milder cough may go on for a few weeks later. And your temperature should settle by about the end of a week. So I think you can just manage this with paracetamol as you need to, plenty of fluids, and then it should just follow this course. Do you have any questions for me?
Yeah, I've heard on the news that maybe I can't go out now because I've got symptoms. What do I do about my family?
So, good question. So, in terms of what we need to do, you need to self-isolate for 7 days, and you're okay to go back to work after 7 days, and you shouldn't have had a fever for 48 hours.
Right, okay.
Now, the rest of your family, they should isolate for 14 days.
And is that 14 days from today?
14 days from the start of the illness.
Ah, right, okay, from when I first got my cough. Okay, we'll make sure. We have been doing that up until now, so thanks for clarifying.
Now, the things that we normally say is if your breathing is getting much worse, i.e. you're not able to talk in sentences, you're finding you're not able to do your normal activities around the house without getting more breathless, you're just getting more breathless just sitting watching TV, any chest pain, you're feeling faint or dizzy, you're not passing urine every 12 hourly, these are kind of things you need to seek medical attention for.
Okay, fine, I'll look out for these things. Thanks for your help.
Okay, and any questions, anything like that, obviously do phone us and give us a call back.
I will do. Thank you.
Thank you.